time for our Health Watch, where we discuss all of the topics trending in the medical world, as much as we can get to anyways. As always, we're joined by Dr. Syed Hussain of Trinity Health of New England. Thanks for being here, doctor.
Thank you.
The doctor is on call. So starting with a bit of an adult topic here, but a new report from the CDC pointing out that STIs, sexually transmitted infections, have started to go back up after what we saw was a dip during the first year of the pandemic. So not good news on that front. But what do we do? How do we bring those numbers back down?
Yeah, great question, Keith. And this is definitely concerning. And while we're not at pre-pandemic levels for STI infection rates, this includes chlamydia, gonorrhea, and syphilis, it is on an uptick and likely an undercount, so probably even higher than what the CDC is reporting. The reason I say that is because we know folks are really not seeking out care. There's not a lot of adequate screening and treatment programs in place that we could have more, I should say, as well as the importance of education around safer sex, using condoms, etc. The biggest concerning point for me as a clinician is the rise in syphilis. Where we were in 2000, where we had a little under 31,000 cases nationwide, and now it's a little under 200,000. And wow. For babies that are born with congenital syphilis, it could be almost a death sentence. And it shouldn't be this way. So what we need really is ramped up screening, treatment, as well as awareness and education across the country.
All right, let's stay smart, folks, on that front. Want to talk about, there's a lot of talk about artificial intelligence right now. We've been talking about it on a different front this morning. But learning out of Boston, they've created some kind of AI technology that may help folks detect lung cancer a whole lot sooner than a traditional CT scan. What are we looking at here, and is it a game changer in the fight against cancer, do you think?
This is very exciting, and we spoke about the use of artificial intelligence in gliomas last week. This study deals with lung cancer, as you mentioned, and basically will enable doctors to detect cancer even before it actually pops up on a CT scan. So folks that are higher risk of developing lung cancer include those that have been smoking, and the current CDC recommendations include that they need to get a low-dose CT scan. But the AI tool here that researchers looked at in Massachusetts enables doctors to be able to pick up cancer and even predict whether an individual will develop cancer, the percentage of what the certainty would be over the next year or two. So this is very, very encouraging. Of course, needs to go through all FDA levels of approval, but it shows you the promise that AI holds in terms of medical diagnostics.
That is certainly exciting. Want to squeeze in one more if I can. This is an issue that has hit my family particularly hard. A twin brother and an older brother came down with Lyme disease. The impact on their bodies just wild. But Moderna now saying that it's working on a potential vaccine. Who would that be for? What are your thoughts on that front?
Yeah, I would. This is also quite exciting, and this would probably be deployed mostly in areas where we know there is a large uptick or prevalence of Lyme disease, such as New England, for instance. Moderna is working on a number of vaccine candidates, including that for Lyme disease, which we really haven't had a vaccine for. So encouraging news indeed, but also some other conditions, norovirus, which causes a common stomach flu.
A lot to watch there. Listen, I don't speak for the doctor. I said it's good to get outside and get the blood pumping on a day like today. Would you say that is a safe bet?
Absolutely. We've been waiting for this.
All right, doctor. Always good to see you. Do want to point out that there's a lot going on happening this weekend. Trinity Health in New England will be offering, it's your third Men's Health is Community Health event, which is great. And that event will be this Saturday at the First Cathedral on Blue Hills Avenue. That will be from 1:30 to 4:30 p.m. Men, I'm speaking to you at home. We don't talk about our health enough. We don't take enough action. So this is open to the public. Parking is free. Again, 1:30 to 4:30 on Saturday. Men's Health is Community Health. Doctor, always good to see you. We'll see you next Wednesday.